Welcome everyone to our second Wednesday seminar for the Department of Population, Family, and Reproductive Health. We're going to continue on the series that we started last week with stories of our faculty. So I'm delighted to soon introduce some of our faculty in the department who'll tell you a little bit about themselves and what sparks their passion in public health or just words of wisdom that they want to share with us at the start of the academic year. I'll ask folks who aren't speaking to please put themselves on mute. Feel free to add comments to the chat. And for those of you that are new to the department, you'll know that this is part of our series. We meet most Wednesdays except the last week of the term and really use as our sort of underlying theme different topics and speakers who speak to themes of the department, including our focus on population and our focus on life course. So with that and without further ado, I'm going to ask Dr. to say hello and introduce himself.
I welcome a new year, all welcome new students and returning students. One fine day in 1991, long time back, I landed just like you as a student here. I like this place so much, I never left. I'm still here. And very interestingly, many of you know me teaching statistics or in a methodological area. I work in statistics, and some may also refer me as a statistician. I am not. I was trained as a physician and trained as a demographer. In medical school, I'm from Bangladesh. We never learned anything about statistics. I did not know what is mean, what is mode, what is variance. Mean, of course, I know, but not mode or variance. But when I joined a small research organization, I became very fascinated with reading statistical public health paper on family planning. The work was on family planning. Because I did not know anything about the statistics, it was very difficult for me to read those papers. I came across different terms like logistic regression. I did not have any idea what is the meaning of logistic regression. Similarly, I came a term called the multiple classification analysis. I never heard of it. So I asked my statistician colleague, what is the meaning of this thing? And he became a little bit of annoyed with me and he said, okay, if I tell you, will you understand it? So that really struck my core. That, okay, if you can understand, why not me? So I started reading statistics and I told him that now I'm asking you a question, tomorrow you will ask question to me. And that exactly happened. And now I can see that I'm teaching statistical courses and essentially probably has some idea what is the statistics. So what is the moral of this story is never say you cannot do that. Okay, it is easy, and many students really sometimes tell me, oh my God, statistics, can I do it? Of course, if Saifuddin can do it, you can do that too. Thank you.
Thanks so much, Saifuddin. I love that story. And I don't know if Saifuddin can, if you can do it, if I can do it too, but I'll keep that in mind moving forward. So thanks for sharing. I'm gonna ask Dr. Strobino to say hello.
Hi, everyone. Welcome to the noon seminar. And like Saifuddin, I landed here many years ago as a student. In fact, it was 50 years ago last week. But I'd like to tell you a little bit about my story, about how I got here, because I think for many of you, it will resonate in terms of how you feel about school and what you plan to do. So basically, my passion began when I observed my recently widowed mother grappling with having to take care of two young twin adolescent girls and never expecting to become a widow or have to take care of them and be a single parent and raise them alone. And it sparked my passion for thinking about how do we improve the well-being of women, families throughout their life course, particularly those with young children. So sort of at the same time, I thought, well, gee, I'm going to go into social work. I think that would be a great profession. And then I took chemistry and I loved it. And I did it and I was good at it. So I decided to major in chemistry in college. And after I graduated from college, I worked in a microbiology lab as a research assistant. And I found after about a year that this isn't right for me. Lab work is too confining. It's not the way I think. I don't think about cells. And I loved writing up the experiments and particularly the more analytical parts of the experiments. At the time, there was roughly about the same time, there was a fellow in our lab who was part of the medical committee on human rights. And he and I had had some discussions while I was assisting him with some of the experiments he was doing. And he told me about some events that were going to center around abortion rights with the medical committee. I was in Boston at the time, and it was the same time as the women's movement was starting and the Boston Book Collaborative was publishing Our Bodies Ourselves. So I went to this meeting and I thought, wow, this is what I really want to do. But I still didn't figure out how was I going to be able to do that. And about the same time, serendipitously, I ran into a former college friend who had graduated in biology and had the same dilemma as I did, working in a lab, didn't want to do it anymore, and had discovered public health. Well, at the time, the only way to find out about public health and public health schools was to go to the library. So I went to the Boston Public Library, looked up the 15 schools of public health, and found 3 that had population centers and 3 that were safe schools and applied to them. And Hopkins accepted me. And I started as a master's student in population dynamics, moved to a PhD student, and then into the faculty in maternal and child health. And like Saifuddin, I felt like here I was. This was something that I really loved doing. And it was a place where I could pursue my passion and where I could do what I did well. And so the moral of my story is that many of you are young, you don't know where you're going. It's an evolution, it's a journey. You will figure it out. Best of luck.
Thanks so much, Donna. And I might add, you have lots of faculty and colleagues to help you figure it out. So feel free to tap us anytime.
Yeah.
I'm going to ask Dr. Bethell to join us.
Hi, everybody. So, I just like Saifuddin and Donna, my passion for public health began pretty early in my life without me even knowing it. And my childhood was actually a living laboratory of the connection between social determinants, relational health, and systems, and how they interact with families to help them or not. And somehow that went into me in a way. And early, when I was even in high school, kind of volunteered myself as a youth advisor to the local conversations that were happening about, creating a community, and there were safe parks and the American with Disabilities Act. And I'm not sure how that happened, but I sort of got myself involved in that, and it kept going, but it wasn't a named area yet. And how I got to kind of where I am now to being kind of a person who focuses a lot on data and measurement and the use of that for policy and research, and freeing that data and making sure that it's from the people in a valid way, which has really been the hallmark of my career, even though I started with torturing administrative data and electronic data, thinking that was going to have the answers. It was so inaccurate, and it didn't reflect anything about actual health or well-being or lived experience of people, and the systems didn't know anything about them. And I really figured that out when, so the story I'll tell this year that's a little different than before is I started out being trained as a health services administrator, thinking I was going to go help systems that already existed become more well-being oriented and financed in ways that would incentivize them for prevention and all of that. This was when I was 23, and I was doing the MBA and PhD program at Berkeley, and just was devastated by the fact that people didn't have health insurance, that the coverage was all disease-based, that there was community benefit standards, but nobody was really doing anything to help the community. And I was like, darn, I'm going to have to do something different. And so I ended up doing a series of fellowships, one of which was actually in Los Angeles, in policy working with the mayor. And I was charged to go out and try to find out what was going on with families that were getting into domestic violence shelters and homeless shelters. And I had to get up really early and go down there at 3 a.m. and ask them questions. And I got to make up the questions and I got to listen to the answers and then try to feed that back to the system. And it was completely unknown information. And as soon as the system started hearing from people, there was a that happened, like, oh, how we check people in and the questions we ask them or don't ask them, the context we get about their lives. Like we just do this like transactional little piece where you come here for a few days and then you leave, but could we do it differently? And the power of that in very many places is what activated me on bringing together the voices of people who were trying to support, figuring out what were we trying to actually do and even articulate that. And the systems, the domestic violence shelter saying, what is it that we're trying to do? Are we just a hotel where we don't want people to die? Or are we actually trying to help build health and life and futures for people? And getting that information, transferring it to the people who need to see it, and then coming up with solutions, and even having the homeless shelter go with the domestic violence shelter, because sometimes families started in the homeless shelter and got to the domestic violence shelter and they didn't talk to each other. So it's just a little kind of example of, for me, it was mind blowing. And then when I went to look at, I was in DC and another fellowship, there was no data, especially for kids at all. None. There was birth and death records. That was it. And you didn't know anything about child health or what have you. So I went kind of by force into a PhD program to learn both econometrics, statistics, and measurement theory, and try to tie it up to how we could start to inform our systems, and really emphasizing the voice of the family, because it was during that time I did torture a lot of administrative data and found out that it really wasn't giving us the information we needed. So, but the passion was soon in my life, and it continues to play out. And now my focus is very much on promoting a sort of whole child, whole systems point of view, and trying to empower a measurement for what I call a whole child health policy, and addressing those social determinants at the systems level, as well as empowering families to and communities to heal. So hopefully that wasn't too long.
That was perfect. And what I really love about these comments is that you're hearing about early life experiences that many of our faculty have had, and many of you are taking life course this year, and we're going to be talking about that later this afternoon. But these imprintings on us and these conversations really have influence that many have taken. So thank you so much for sharing, Christy. That was awesome. I'm going to ask Dr. Bose to join us next. Krishna?
Hello, everybody. People who know the work that I do know that I'm passionate about adolescents and youth and improving their lives. But it's interesting to hear what Donna said and what Christina said, because I also used to be a lab person in science. I also loved chemistry at one stage, and then I moved into public health. And I was in this other school of public health in Michigan when I found out about this wonderful child survival program at the Johns Hopkins School of Public Health. And I got selected in 1987. I came to Johns Hopkins in 1987, 31 years ago, as a child survival fellow. Spent 2 wonderful years in India with CARE International, learning about the public health system of my own country, and then joined the Epidemic Intelligence Service program of the Centers for Disease Control, where I did my first adolescent health work. So to students, I would say, keep your ears and eyes open, because something clicks somewhere along the way, and only when you look back, you can see the coincidences, and you don't see it going forward, but take every opportunity. And so I was tasked to do a survey of New Jersey adolescent students on smoking as part of my graduation seminar at CDC. And lo and behold, I found out that only 7% of Black students reported that they were smoking. In similar socioeconomic status, 24% of white students reported smoking. And in well-to-do Princeton schools, only 7% of students were smoking. And I was convinced I'd done my analysis wrong. And then we found out that actually Black students don't smoke. And there was a national survey that then showed similar rates. And what I want to emphasize is what Phil said yesterday: don't go in with preconceived notions of happening in a community. Open your ears and learn. And as Christina said, since then, I am data-driven on the importance of data. And if you think there's no data on children, there's even less on adolescents. As TCI knows, that's my mantra, we need data. And so after, that was my first experience with adolescents, then in UNICEF's Evaluation and Research Office, we worked with children in difficult circumstances, street children, urban adolescents in Manila, in Rio. And as Dylan has mentioned before, we then worked with the police system to actually improve how police understood the importance of the Convention on the Rights of Child, that these children were trying to make a living for their families. These adolescents were not miscreants. And so that started really getting me passionate about adolescents and youth. And then, of course, the HIV epidemic that was fueled by adolescent girls was staring us in the face. So when I landed in WHO in Geneva, that became what I really did with my life. But there's a small coincidence in there that in 1996, in November, I was sent to a meeting in Paris at the European chapter of International Adolescent Health, focused on measurement. And who should I meet as soon as I walk in the door but Dr. Robert Blum, Bob Blum, who became my mentor, my friend, my collaborator on the Rockefeller Measurement Project for Adolescent Health that I headed with 7 countries in WHO. And then one day after I retired from WHO, sitting at the airport, coming to Baltimore to meet my daughter, who did her master's in public health from Hopkins and is now a lawyer at the Center for Medicare and Medicaid Services, I get an email on my phone, and it says from somebody called Kate Graham at the Challenge Initiative that there's a position for a senior adolescent and youth sexual and reproductive health advisor at the Challenge Initiative at Johns Hopkins. Would you be interested in applying? Well, the rest is history. I immediately called Bob Blum, and then Ying Rimon was wonderful and gave me this extraordinary opportunity. I don't know how I missed meeting him when as a child survival fellow, when I went to see Phyllis Pietro in 1987 at what is now the CCP, but we met again. And I walked into the office the very first day that I was assigned, and there was this big parchment on the wall, about 6 feet by 3 feet on top of the filing cabinets, that was identical to what is on my bedroom, still in Geneva. It was a piece from a Rajasthani scene. Mine one is red and green. This one is orange and green. I bought it as a child survival fellow at the fair in Delhi at the exhibition. I realized I've come home. I've come home back to Hopkins again. Wonderful coincidences, but always keep your eyes and ears open. You never know what's around the corner. Thank you so much.
Krishna, thank you so much. I love that story. There's so many connections across and within our department, let alone to colleagues in the field. And I think your story really exemplifies that. I'm so glad you took that email when you heard about the position. So all to the benefit of the department and all of us as learners. So I'm going to invite Dr. Decker to join us next.
Wonderful. Thank you so much. It is just, I get such a kick out of hearing all of these stories, and it's always sort of universally a little intimidating to go after Krishna because her passion is so tremendous for this work. So I hope that I can follow in those footsteps. But I will tell you, I mean, when I think about how I got here, I've been on faculty now for about 11 years here at the School of Public Health. And, you know, I never imagined ever that this would be sort of where I landed in life. I came into my undergraduate training. I was really passionate about social justice. I wound up in an undergraduate sort of public health program. I did a double major with women's studies. Everyone in my family said, what on earth are you going to do with women's studies? And so I said, I don't know, you know, and it wound up being a little too theoretical for me. So I wanted to just kind of jump into direct services. I was doing a lot of work on sexual violence prevention and response as a volunteer advocate, fielding, you know, crisis calls, emergency visits, et cetera, and really sort of got steeped in that community and that field, but had a feeling that I needed to do more than direct service. And so that's really what sort of brought me into public health. I had a strong math background, and I had a lot of questions about why we were seeing the problems that we were seeing and how could we learn from those experiences. So that very much brought me into training in a master's of public health degree, worked for a little while at the state and local health departments, thinking, gosh, I really needed to kind of get back to the ground. And, you know, I think there was sort of a sense that perhaps, you know, some of the more applied training or sort of the higher level training, the doctoral level training might be a little bit too theoretical or sort of academic. But I will say that I really found my sweet spot in public health because of that applied element, where I could bring in sort of the connections and the collaborations with community voices, community partners, state and local health, whether it's here in the US or globally at ministries, bringing those stakeholders together to really understand, like, what are the pressing problems that we're facing? How do we generate the data that's going to help us position a response to that? And so that's really what I feel I have come to now, sort of in this role on faculty. And so it's kind of incredible when I think about it, because all of that training in women's studies and public health and disparities frameworks, et cetera, allow me to do the teaching and the training that I do here in the department. Our women's health disparities course, our gender-based violence course, which I have the pleasure of teaching here at the school. And so I'll tell you a little bit of, so one message I think is sort of follow your instincts and follow your passions. I think you're hearing that from everyone this morning or this afternoon. And then I'll tell you just a smidge of a story within a story, which is that when we first started doing these faculty stories, I presented the work that I do, and I said, you know, I come to campus every day and I'm living the dream. I am living the dream here at Johns Hopkins, working with these amazing students and colleagues and collaborators. And 2 days later, I got a knock on my door, and I said, oh, come on in. And it was Bethell coming in, and she had found this little sign, this little placard that said, living the dream. And she said, I saw this and I thought of you. And I said, oh my gosh, thank you so much. And it was so sweet, such a sweet acknowledgement and such a wonderful way to sort of keep that positivity moving and keep that messaging moving forward. And so when you visit my office, you'll see that it's still in my office. I wish I was here today, or I would show it to you. But Christy, I'll thank you again for that sweet sort of, you know, positive movement, keeping that moving forward. And hopefully that's a little bit of the energy that you'll feel from faculty, collaborators, colleagues, and students, especially for students as you're starting off on your journey. So thank you so much.
Thanks, Michele. That was awesome. And I love the living the dream story. I think many of us feel that way. I see Krishna with 2 thumbs up as well. So that's awesome. I'm going to invite Dr. Holliday, Charvonne, to join us.
Good afternoon, everyone. I am so excited to be here with you today. It's always exciting to welcome new people into the department. I am an assistant professor in the department, and I think, like Donna and Saifuddin said, I've been here for a little while. I did my postdoc fellowship in the department, and then I've been on faculty for about 4 years now, having the opportunity to train under with Michele Decker, and I'll talk about that in a little bit. But I want to echo something that Michele said, and the sweet spot, finding the sweet spot. So I didn't realize actually that so many of my colleagues started out in the sciences in bench science as I did. So I started out as a biologist doing breast cancer research, focusing on racial and ethnic disparities in breast cancer progression. And it wasn't my sweet spot. It wasn't, I wanted to work with people, you know, rather than blood and tissue. And I found public health by accident. I was a Gates Millennium Scholar, first generation college student, and I didn't really know much about public health, but I knew that the Gates Foundation would pay for a degree in public health, and I made some connections and thought that it was worth pursuing. I always had, as I said, always had a passion in women's health, but I wasn't quite sure what direction it would take me. I actually thought I would be a gynecological surgeon. That was where I was really headed. But I found the sweet spot in public health. So I want to talk a little bit about change. So I'll share a quote from Socrates. The secret of change is to focus all of your energy not on fighting the old, but on building the new. And for me, that's most relevant, especially given my focus on racial and ethnic disparities and thinking about historical contexts and how that influences public health today. And so while we recognize and we acknowledge the old, one of the things that I most appreciate about public health is that we build the new. And so that is what is my passion. That is what drives me in this field. We build the new, we build the evidence, we inform the policies and practice, right? And so whether that be focusing on chronic illness or disparities in experiences of violence, this is where we live. I believe in change, and I believe in the power of changing behavior and attitude and structures. And so that is what makes me appreciate public health the most. Where my research fits is addressing gender-based violence, specifically intimate partner violence. And my passion for this field is specifically related to intimate partner homicide. So I work with survivors of violence as well as men who cause harm in their intimate relationships, recognizing that we can influence structures and systems that might facilitate folks causing harm in their intimate relationships. We can change people's attitudes about gender norms and equity. And so one of the things that I guess to leave you with advice would be to, which has already been said, is to build your connections and really follow your passion. So I mentioned Michele, and one of the things I was thinking about before this presentation is that I met her at a meeting at the National Science Foundation before as I was a doctoral student. I was there with a mentor who happened to be a close collaborator of Michele's. And so I don't know, Michele, she's such a big deal. She probably didn't really notice me at the meeting, but I never knew that that was a glimpse, right? That was a glimpse of what my future would hold. And so similar to Krishna, whenever I was finishing my doctoral program, I was looking for postdoctoral fellowships. I got to Hopkins through the School of Nursing. And then something shifted in funding, and my mentors were helping me find positions. And so Michele had emailed a postdoctoral fellowship in the department. It got back to me through mentors. So I'd never known, 2 years prior, seeing Michele at that meeting, that I would then be working with her as a mentee and now close collaborator. So welcome everyone. I look forward to getting to know each of you.
Thank you so much, Charvonne. And I guess like OBGYN surgery loss is our gain in population, family, and reproductive health. So glad that public health found you and you found public health. So it's all very much to our benefit. So thank you for sharing. And I'm going to invite Dr. Karp, Celia, to say hello.
Thank you. So my public health story, I'm also going to rewind a little bit like others have done today. My public health story starts as a naive 19-year-old in college in North Carolina, where I was studying Spanish and communications, which I loved. And my boyfriend at the time was diagnosed with leukemia. He's healthy and well today. But I'm telling you this story because as a 19-year-old, we both felt really invincible, and like those big health issues weren't as relevant in our day-to-day lives. But that experience of kind of going through the diagnosis with him and trying to support him led me to being really frustrated and angry, but also, on a positive note, led me to find the Leukemia and Lymphoma Society, which during college I became the regional coordinator for high school programs in 3 counties in North Carolina. And I educated students and helped lead campaigns for fundraising for blood cancer research. And I absolutely fell in love with it. I fell in love with the work, and I really poured myself into it, just channeling kind of all of that frustration and passion into something that was actually productive. And for me, that was kind of my aha moment, because people kept telling me that this was public health work, and I wasn't super familiar with everything that public health encompassed at that time. So I added public health as a major and kind of became involved in a bunch of different projects in public health, and started understanding all of these different facets, the different areas from research to practice, kind of that Michele and Charvonne were talking about, and really took advantage of some internships and jobs in a bunch of different areas that are completely unrelated to the work I'm doing now. I worked in environmental health at the CDC for a little, and in HIV/AIDS programs at USAID. And to pull that sweet spot language from Michele and Charvonne, for me, I realized that wasn't my sweet spot. It wasn't the topics that kind of woke me up and energized me every day. But I still took something from each of those experiences. And then fast forward a few years, I lived in a few countries in Latin America, and I was working in maternal and infant health. And really discovered a passion for sexual and reproductive health, and working to ensure that people have autonomy to make decisions about their bodies. And that kind of pulled me into applying to PhD programs, which is how I ended up here at Hopkins. And like many of you, I discovered just how boundless the opportunities here are to get involved in all sorts of different projects. So for new students, 3 little tidbits of advice. Much of this I realize is now repeated from our previous speakers, but just to reinforce it, to really express your interest and kind of stay connected to the people who you see also working in those spaces. Even if you don't work directly with them, they can connect you to other opportunities and people that might help move you forward. And to build your network, both with students that are in your cohort, but also faculty and staff that are working in those spaces. And then really to seize opportunities when you see them and become more involved. So now as an assistant scientist in the department, I love the work that I have the privilege of doing in women's sexual and reproductive health. And I'm a people person, and I cannot lie when I say that what it is about Hopkins is the people here are phenomenal. And having the opportunity to work with the staff, the faculty, students that come to Hopkins is the thing that wakes me up and motivates me. And so while you're here, find your people and Carpe Diem.
Love it. Thank you so much, Celia. And you didn't say anything about take a Zumba class, but you could have said that too. So for those of you that don't know, Celia is also a Zumba instructor. So one of these days she's going to get me out there. So I'm preparing for that. So thank you so much for sharing. I'm going to invite Dr. Lulita to say hello.
Hello, everyone. Good afternoon. And actually, probably many of you don't know, I also teach Zumba, in our Chinese school as well. So that's the connection there, Celia. The energy is fantastic here. So welcome again, everyone, to the new school year. So again, my name is Li Liu, and I'm an associate professor in the department. I also lead the population and health area of interest, and I teach advanced demographic methods in public health in the 3rd quarter, and serve as a laptop instructor for population dynamics and public health in the summer and 1st quarters as well. So today, I want to share some stories of gaining life's perspectives through, personal and professional experiences, and then bringing them together into, my own research and teaching as well. So many here probably know that I have a set of lovely twin girls, and Donna of course knows, and they are 12 years old, and I have a lot of friends who have commented on the efficiency of having twins before. However, fewer knew that pregnancy and postnatal periods were quite eventful for twin pregnancies. For example, Audrey, my younger one, was only born at 2 pounds and 3 ounces, and after delivering, both of them the night before, I went to see Audrey first thing in the morning in the neonatal intensive care unit, or NICU. So I still vividly remember this very detail, that as I was passing the nurse station, holding my urine bag in my hand, the nurse on duty actually joked, "What a nice bag." So when I arrived at the NICU, the first thing I was asked to do was to actually have this skin-to-skin contact with Audrey. So as many of you know, this is a medical and public health intervention, often referred to as the kangaroo mother's care. And the intervention has been shown to stabilize the newborn's body temperature, and has become an effective and low-cost intervention to improve neonatal survival, particularly in low-resource settings. So now, of course, Audrey is a healthy and happy 7th grader. Well, fast forward to 10 years, I was actually in Guinea-Bissau, West Africa, for a field visit. So that day, I visited both the maternity ward and the NICU of the National Hospital of Simon Mendes. So this is one of the 2 largest hospitals in Bissau, which is the capital city of Guinea-Bissau. So I was again pleasantly surprised to see that some fathers in the NICU were actually giving kangaroo mother's care, or should I say kangaroo father's care in this situation, to their newborns. So, at that very moment, I felt the love and care those fathers were providing to their newborns, which were exactly the same as what I did to Audrey 10 years ago. I also felt like never before the power of public health interventions, and was hopeful that those NICU newborns would live a healthy life afterwards. I also felt a strong connection between what we public health professionals can do and how lives are being saved, millions at a time. Well, unfortunately, I also learned that day that the NICU was only, a temporary unit based on, limited funding from Doctors Without Border. As Guinea-Bissau is not a donor's favorite, and it's not of high political relevance. Once the funding ran out, in 2 months' time, the NICU would have to stop functioning. So this was very disappointing and even devastating. So I went with my local collaborators to try to raise awareness about the significance of the NICU unit while I was there, but the efforts were not effective. So, this further emphasizes how much remaining work there is to continue to end preventable neonatal deaths globally, and we can all find a way to contribute. So I guess, through these stories, you may have learned a little bit or some hints about, my work. I work on child and adolescent mortality and causes death globally, and also teach about child mortality in my third quarter, the advanced demographic methods course. But I think, the personal and professional experiences gained throughout these stories, they do not only expand my life's perspectives, but also help anchor and renew my research and teaching interests. I really look forward to continuing the expansion with all of you in the new school year, and welcome again.
Thanks, Lee. Great to hear sort of the stories of anchoring, of what motivates us and grounds us. And I love the kangaroo story and sort of the approach to family health, recognizing the important role that fathers play as well as mothers in the care of newborns in the NICU and beyond. So thanks so much for sharing. I'm going to invite Dr. Mendelson, Tamar, to say hello.
Yes, hi, welcome everybody. It's amazing to see so many of you here. So I guess my journey began in a very different place, in that growing up, my passion was really literature, reading, and also writing stories. I loved to write, also loved to create art. So those were my passions, and I didn't really know what to do with those. And after college, I worked in book publishing briefly because I thought, well, I love literature. But I found that was not the sweet spot, as we've been talking about. First, the industry was very marketing driven, but also I really missed the parts of the academic life that I'd had. So I missed that, and I really missed or wanted to do something that was more directly helpful to people. And looking back, I think a lot of my passion for literature was about how it brought to life people's experiences, their suffering, their joy. What does it mean what does well-being mean? What kind of drives us as humans? And so I had sort of this epiphany that I wanted to go into clinical psychology, and that would sort of allow me to get back to sort of the reading and writing, but also to be kind of useful to people and have direct contact. And so I got a PhD in clinical psychology. That felt like a better spot, but, I was really always a bit turned off by the sort of pathologizing emphasis in psychology. And, that may have changed to some extent since my training, but that I was always a bit ambivalent about that. And when I went on my internship, I went to a public sector hospital in San Francisco and was working with clients who were living in poverty and facing very traumatic issues in their lives, and a lot of adversity related to their poverty. And so I realized that my training was really not adequate for handling that. And in fact, in many ways, there were moments where it actually felt sort of offensive to be talking to folks about, say, like dysfunctional thought patterns, when things were very, there were some very objectively sort of wrong things happening in the environments. And so I really got interested and aware about the social determinants of mental health. And I was really fortunate to work with a mentor who was looking at prevention rather than treatment, and about how do we create strategies where we can reach folks who may not have access to treatment or may have a lot of stigma around that. And I was lucky to work in a Latino mental health research team and really think about these issues also in terms of how do we culturally tailor prevention programs. And this just opened up a whole new world to me. The idea of prevention really appealed to me. I should add that I had no idea that public health was a thing. So at this point, I was fortunate to be accepted into the Robert Wood Johnson Health and Society Scholars Program, which is no longer around, but was really a wonderful program. And so went to Harvard and did a fellowship there with that, sort of an interdisciplinary population health focus. Got some more training around what public health is and interdisciplinary methods. And that's what brought me to Hopkins in 2006. And since that time, I've really shifted to being a public mental health researcher. And, I think that I'm very fortunate now to be able to work on these broader sort of developing and testing prevention strategies and promotion strategies that enhance young people's mental health. And I particularly love working with young people themselves and hearing their voices and their perspectives on what kind of makes them feel like they're flourishing and thriving. And in some ways that loops back to my original, I think what really loving to hear people's own experiences and their own voices, and yet having an applied sort of population health focus. So that's really, I feel incredibly fortunate to have found that mix of things that really, makes me excited. And as others have said, super excited to just get the chance to be here and work with amazing people. And I guess, kind of echoing a message that others have given today already, I think, it's very anxiety producing at times when you don't know what you're going to do next or kind of where something is leading. And I guess, I would just say, try to go with that it all ends up making sense, even if in the moment it might not. And that, forward motion is often not linear, and that's okay. So trust the process. Thank you.
Thanks so much, Tamar. It was awesome and lots of great themes there. And I think what we're all hearing is that we all apply different disciplines in the work that we do, but we all really want to listen to voices of what's actually happening on the ground, not relying on our intuition, but using data and evidence very broadly defined. And really our focus as a department on thriving across the different age groups and developmental periods that we focus on, thriving across individuals and populations. So we just so happen to have another adolescent expert following you. So I'm going to invite Dr. Mmari, Kristen, to say hi.
Hello, everyone. Well, this is so much fun. And I'm hearing already so many similar themes. And my story is also going to follow that. So I guess if I could classify my talk, it would be watch out for those unexpected turns, because I also did not find public health until much later. In fact, when I was in undergraduate, I already had my life so far planned out. I was going to be a neurologist, believe it or not. I already had a job lined up in my senior year where I was going to be working in a neurology lab doing work with the blood-brain barrier. I mean, people that know me would be like, what? Yeah, that's what I thought. And I was feeling so happy that I had it all planned out. I was going to work there for a little bit, then go into graduate school, and then, do the neurologist pathway. Well, about a week before I was going to start, the PI and the director of this lab calls me up and he's like, Kristen, I don't know how to tell you this. There's no money. And I'm like, what? Yeah, you don't have a job. And I'm like, what? And I just was crushed. I didn't have a plan B. And I'm like, oh my gosh, my life is over. What am I going to do? So I was basically devastated. And so luckily though, 2 days later, my aunt calls me and she says, Kristen, I heard life is not going your way right now. I said, yeah. She said, well, I know you graduated with a biology major. How would you like to go to Tanzania and teach in a Maasai boarding school in the Rift Valley? And I'm like, okay, Tanzania, that sounds like it might be in Africa. So she said, yeah, you basically just have to raise your money and you can go over there. I said, okay. So I quickly started thinking about, okay, I've got to start raising money. And I didn't have any teaching experience. So, out of the blue, I looked in the paper and there was a job opening for me teaching biology and outdoor education camp in Michigan. So there I went, packed my bags, and I actually taught a class called In Cold Blood, if you can believe, where I caught snakes and fed them frogs. So that's another story. But while I was doing that, I was raising money. I was talking to any group that would really host me to talk about my plan. And so I was getting microscopes, all of that. So I called up my aunt and I said, this is the amount of money that I have. And she says, okay, I think you can do it. So 2 weeks later, I was on a plane to Tanzania, not knowing how much my life and career was going to change. So I landed in Tanzania. I ended up loving the country so much. I married a guy from Tanzania. I loved everything about it. I almost stayed close to 3 years, but there were two things in particular that happened to me there that really had a huge impact on my career. The first was at the boarding school. Once every term, they would line up all the girls to get pregnancy tests. And the girls that were found to be positive were immediately dismissed. And I remember this one girl in particular, Lydia. She was one of the smartest kids in my class. And I remember right after that test, she came back in tears. And I thought, no. And I felt so helpless. I didn't know what I could do. And the second thing that happened was this was a Maasai boarding school. So I had these girls that came up to me and were trying to invite me to what I finally figured out was a female genital cutting ceremony. And basically, when I figured it out, what they were asking me, the only thing that could come out of my mouth was, well, I think I'm going to be busy that day. And again, this utter feeling of just frustration and helplessness. And I thought, I need to figure out what to do. So the whole idea of neurology was just obsolete for me. I needed to figure out what can I do. So I stumbled across medical anthropology. I ended up getting a master's in that to try to figure out how I can utilize learning about the culture to kind of work within that to build, I guess, health knowledge to feed into health campaigns. So while I was there, a professor actually called me into her office and she said, how would you like to go to Ethiopia? There's a year-long internship working with Johns Hopkins, if you can believe, among early adolescents, also a foreshadow for those of you that know me, to do, I would be basically collecting data for an HIV prevention program. So I did it. I went over there and again, that's when my first realization was, well, what is this? What am I doing? I know it's not really medical anthropology. And someone said, well, this is public health. So anyways, that's how I got involved. That's what was my passion. I ended up getting a doctorate in there. I went to Tulane, and while I was at Tulane, I worked on this global project called Focus on Young Adults. And so that's what led me here. So long story short, watch out for those unexpected turns. I thought at that moment when I did not get that job in that lab, that life was over. It's for sure is not. You've heard that for so many other faculty. And it's really those unexpected turns in life that has made all the difference. So I welcome you all to that. And here at Hopkins, just to show that foreshadowing, I actually work on a study called the Global Early Adolescence Study. So there you go.
Thank you so much, Kristen. That's awesome. I love the fact that you didn't get that first job. It's really great for us. So may have been a huge bummer at the time, but it's been awesome for us and for the field. So thanks so much for sharing. I'm going to ask Ying Rimon to join us next. Ying, you may be on mute.
Oh, thank you to all the students. Sorry about that. Thank you, Cynthia. I actually consider it both a privilege and lucky for me to interact with all of you today. Privilege in the sense that it's seldom that you see oneself, interacting with the best and the brightest in public health. But just think about that. And lucky because even today, I still kind of pinch myself why I'm even here. So I was inspired by Bob Bloom in the first session with the faculty. And let me take you through my journey and life in the next 4 minutes. So I was born in the Philippines in a dusty town in the middle of some island with really no prospects for the future, except that I had teachers and I had parents who wanted me to dream. And I did dream. talking about living the dream. And so I said, if I have to dream, I need to go to the best premier school in the country. I had no idea how to do that, except that I took the competitive exams and somehow I made it. So here I was, 16 years old, University of the Philippines premier campus. And it was the time of turmoil around the world. I became a student activist, a student leader. We would protest, we would close the universities, we would rally with all the other students against the dictatorship and against imperialism at the time. And bear in mind, I was 16, 17 years old. I didn't feel that way at all. Even today, I just feel like I was invincible. Okay. So I was arrested 3 times. My house was raided by the military. But somehow I survived. I hid in a slum area for almost a year from the military. Never did I even foresee that one of these days I would head the largest urban reproductive health program in the world, an urban slums. Think about that. So I went back to school after that. And one of my professors, again here, the theme, with your mentors, said, "Oh, Ying, I don't have expertise on this, but I'm a consultant to the Commission on Population. I need you to help me for just 3 months to set up a mechanism with the Commission on Population, a government entity, very powerful in the office of the president, which can recruit the best and the brightest from the best schools in the country." I said, that's very interesting. So I did. Little did I know that the 3 months became 8 glorious years. I rose through the ranks. I managed the largest community-based distribution program and contraceptives in the world. At the time, 50,000 of them. I met every city mayor in the country, every governor. And at that point in time, also, I said, this is it. What else can you do? And I was lucky along the way. I went to do studies and population studies in a British university. I got a scholarship, at Princeton. And after graduating from finishing Princeton, I was recruited by the World Bank. And here it is, an opportunity, big salary, tax-free, free vacation every year, right? And flying first class at the time. And yet there was this charismatic professor at Hopkins who also got a copy of my CV. Her name is the great Phyllis Putro. And she said, I want also to recruit you. You will never be happy with the World Bank. Your personality, would not fit at the World Bank. But if you come to Hopkins, maybe you can build something together at Hopkins. To make a long story short, I was one of the people who worked with Phyllis, and we founded what became just an idea into the largest communication and behavior change entity in the world based on the university. That's the Center for Communication Programs. So I was with the center and also in the faculty for 23 years. And then I said, maybe it's time to retire from Hopkins. When you hit 55, you're allowed to retire at Hopkins and you carry some benefits with you. So I did that. I said, I wanted to retire from Hopkins and set up my Center for Applied Renaissance Thinking in an island in Bali in Indonesia. And I was ready to do that. I had friends who were ready to invest. And then I got a call. And they said, Ying, Rimon, we think you're too early to retire. Would you like to join us at the Gates Foundation? We need somebody who can help us revitalize the global agenda for family planning. Wow, I could have done that without being paid. That's my passion, reproductive health, family planning. And so that's on a call on a Friday. I was given a plane ticket on a Sunday, and I flew on a Monday and got the job offer the same day. So I joined the Gates Foundation for 5 years, and one of my key achievements there was to help conceptualize and set up the London Summit for Family Planning, which will be raised $2.6 billion of new money for family planning worldwide. And immediately after that, I got entities from Professor Amy Choi, Bob Bloom, and then Mike Klug of the possibility of coming back to Hopkins. And I asked permission from Melinda. I said, I'm going back to Hopkins. And he said, but you're not really leaving, she said. No, I'm leaving, Melinda. I'm actually leaving Seattle. I'm going back to Baltimore. I said, no, but you're not really leaving because you are moving from Gates to Gates, Gates Foundation to the Gates Institute. So I said, oh yeah, if you mean that, yeah, I'm not really leaving. So came back to Hopkins, and I was able to convince Bob and Mike that not only coming back to the Gates Institute, but if we have given the opportunity, I said I would like to help set up the Center for Public Health Advocacy, something which was tried for almost 30 years and never happened. So that's my life history. If you ask me, this is a dream for me to be even here. And I will quote one of my mentors, Phyllis Putro. I would say that think big, dream. You can start small, just do it. So I actually co-teach a course on leadership and health transformation here at Hopkins. But I would encourage every student, if you want to just chat, please feel free to Zoom in, knock on my door, so to speak, and I would love to chat with you. I would like to give back in terms of mentorship from all of those people who have mentored me all my life. Thank you very much.
Thank you so much, Ying. And we owe a huge debt of gratitude to Phyllis Pietro for being so persuasive and what brought you to Hopkins the first time around, and to all my colleagues subsequently who brought you back. So thank you so much for sharing those stories. It's really very inspiring. I'm going to turn it now to Dr. West and invite Allison to say hello.
Thanks, Cynthia. Hi, everyone. It's such a pleasure to have a few minutes with you today. Every year, I have the opportunity of going last, and it's both humbling and energizing. And every year, while I listen to everyone else share their stories, I change my mind about what I'm going to talk about. So this year, I prepared no pre-prepared remarks, so we'll see where this goes. But also every year, it really is a reminder of just how fortunate I am to work with so many amazing and talented people. And I love hearing the stories year after year and hearing new stories because everyone in our department has something amazing to offer. So I think the best piece of advice that I can give to students is get to know the faculty, get to know the folks that work in the building. Everyone has a story, everyone has something to offer. And I know that many of you, I can see in the chat, some of the stories have resonated with you just as they have with me. So I'll just share a few things about myself. I am an assistant professor in the department. I've been here for, since 2016 in a few different capacities. But my sort of road to public health was not a direct one. It was circuitous, as many people have their experiences have been who have shared today. And I will also, just like Tamar and Kristen, say that I did not know that public health was a thing until relatively late in life. I went to a small liberal arts college, worked for a few years after college, was originally in a PhD program in psychophysiology, where I was studying changes in pupil diameter in abstinent alcoholics. And I was very, very unhappy with that. It was not at all applied. I found it to be tedious. Honestly, it bored me to tears. And I knew that that was not my calling. And so after that very brief experience, I thought to myself, well, what am I going to do next? So I took a bit of time, worked with a research firm, and decided I need to find something more applied. I need to do something in community. So I ended up getting a master's degree in social work and worked in that field for 10 years as a clinical social worker. But what really led me to public health, in my first year in my master's program in social work, in master's programs in social work, you have to do 2 year-long field placements. My first was working in West Baltimore as a home visitor. And so going into homes of families with diverse backgrounds, all living in poverty, and the families had been identified because they were at high risk for neglect for a variety of reasons, but also often because of living in severe poverty. And then my second year field placement was at a school. And after that field placement, I actually went on to work at that school as an employee, but I worked with youth, adolescents with severe learning and behavioral challenges. And then after that, I went on to work with another community-based organization up in Timonium. It was at that time called St. Vincent Center, working also with youth with severe learning and behavioral challenges. But in that program was a residential program, and youth who ended up in that program generally were there because they had already experienced multiple failed foster care placements. So this was really kind of, I hate to say a last stop, but oftentimes at this point they had tried many, many things and they just weren't able to live in community. So after having these experiences, doing home visits in West Baltimore, working with youth with many, many challenges in the school system, and then working in this residential facility, I just found myself thinking, how did we get here? And what can we do earlier in the life course of these youth to try to sort of interrupt this pathway? And I really wanted to understand what are the factors that lead us to get to this point. And that's really what led me back to my PhD program. So my PhD is in social work. Social work shares many things with public health, I've come to find, including a great emphasis on understanding human behavior in the context of the social environment and social determinants of health and well-being. So I found that once I came to the School of Public Health, all of these things really resonated, and it just feels like home. I found myself really, another impetus for going back for my PhD was really wanting to affect change on a broader scale. So I'm very grateful to have the opportunity to work in the department with folks like Cynthia Minkovitz and Ann Duggan, doing research that focuses on strengthening services for children and families, and also systems. So we do a lot of work with home visiting, but also other services, child welfare, doing a little work with WIC. It's all very, very applied, which really gets me excited. We have a lot of interaction and really focus on hearing from voices in the field, as others have talked about. So that's really a little bit about my path. I'll just put a plug in. I teach a 4th term course that is a service learning course where we work with community-based organizations in Baltimore City. For those of you who are interested in doing some applied coursework, and it's called Applications and Program Management, Program Evaluation, Program Monitoring and Evaluation. Sorry, tongue-tied today. But I encourage you to take a look at that if you want to do some work in Baltimore City during your time here in the program. But again, thank you for giving me some time, and yeah, I'll just end with that. Yeah.
Great. Thanks so much, Allison. And it's really great to hear about everyone's paths and how formative some of those early experiences were with wanting to make change for what we were seeing on the ground. And in your case, experience in visiting families and homes, and then being in community organizations where folks who had challenging early starts were having difficulties having their needs met and wanting to intervene early. So I think that gives everyone just a really great snapshot. You haven't met all the faculty in the last 2 weeks, but you certainly have met some of us. And there are many more also who look forward to engaging with you over the course, the time that you have here with us in the department. I want to thank everyone for joining us, and especially thank our faculty for sharing their stories. And we look forward to working with each of you in the months and years ahead. So thanks so much, everyone. And a special shout out to Dina Dharam, who made this all possible behind the scenes. So take care, everybody. Have a great week, and we'll see you all soon.